So the massage of the shoulder. So this video is hopefully going to give you a few ideas of how to massage the shoulder. Now, obviously, there are 100 ways and 100 different links between your techniques, and there is no right or wrong answer. What we've provided hopefully within this video are a few ideas of sort of how we might work the shoulder and clips of how they're hopefully going to link together a little bit for you. So what we're starting with, as ever, is probably some quick effleurage, warming up the area, and then there's a little bit of sort of light petrissage as well to just get a little bit of movement, warmth, and your lotion across the area.
There goes Charlotte with her elbow again, but if you look how careful she is with it, it's between the spine and the scapula, so she's not actually running over bone with it. And most of the pressure is actually through the elbow, so she's finding the soft tissues between the spine and the scapula. So don't run over bone with your elbow, it will hurt your client.
Certainly will. So again, they're a different type of sort of effleurage technique with a little bit of cam and spindle going on, adapted as you can see. Then into a bit of gliding, so mix it up a little bit here. So again, cam and spindle, you'll often put a little bit more pressure through in this area. And then move your body and glide around the scapula. Now, I quite like this as a technique. It really starts to give you as a therapist an idea of what might be restricting around the shoulder blade. You'll feel areas of tightness as you go around. And then as well here with the rotator cuff, just looking a little bit more at the infraspinatus and across the top of that scapula.
You can, if you're feeling really brave and possibly mean to your client, start working through subscapularis as well. But that's quite technical, and we'll show you that in the classroom. I think that's easier. But you can work all of the rotator cuff muscles, which is really important because they do tend to get very overloaded, these muscles, don't they? They certainly do.
So again, what we're looking at here, a little bit through the top of the shoulder. You can see what I'm doing is actually now mobilizing the shoulder a little bit, so getting the joint itself moving. Really nice to add a little bit of variety into your massage, not pulling it around, just a little bit of gentle mobilization.
The only time you really need to be careful with things like that is with the age of your client. So if you've got somebody that's got a particularly bad shoulder problem, arthritis, anything like that, be a little bit careful. But somebody that's young and fit or just got tight shoulders, really useful technique to get things moving.
So again, having warmed up, what we can see here is a little bit of a friction across this area. So it can be quite uncomfortable. Again, as with all these things, talk to your client. And hopefully what you notice then as well is the body position right above the technique, not leaning into it. It's a really good balance with the pressure direct down rather than angled.
And then there was a huge amount of effleurage flushing through after that. So here Charlotte's actually put my arm into my lower back. So this opens up the scapula to allow some access in underneath on the medial border and just to open out those muscles on that medial border there. Be careful with this. If your client can get your arm in the lower back, that's great, but not everybody can. So keep an eye that the elbow isn't raising off the couch, because that will show too much tightness and the fact that it's probably pulling and a little bit uncomfortable. But firstly, I'm very mobile, and secondly, I don't have those sorts of problems, so I can get my hand into my back. So a useful place to put to do, but not always practical.
No, make sure you're listening and working with your client. So what it does do, however, is mean that you can apply a lot of similar techniques, but it will give you much more access, as Tamsin says, to that medial border. Now that can mean that it becomes much more sensitive. So again, gauge how much pain your client's in and make sure you're communicating with them during that treatment. Now, I love working like this with the shoulder, with the hand and the small of the back. A little bit of butterfly, reverse butterfly back towards you along that medial border of the scapula. Really effective. Again, keep it controlled, keep it slow. It can be, like we say, quite uncomfortable, but very effective when used correctly.
I generally always ask my client to put their hands into their lower back. A lot of people just do it for the client, but I will ask because they'll put it where it's comfortable, whereas you're doing it for them. You kind of twist them in funny directions.
Absolutely. What I think it also shows you, if they move it themselves, is there any sort of compensatory movement patterns?
Yep.
If they can't just relax and pop their hand on the small of their back, they've got to lift the shoulder blade up, they've got to wriggle their arm around.
Yep.
It shows you an awful lot actually about which areas you're going to go and treat next.
The other important thing to remember here is where people or where clients put their arms. So mine are hanging off the side of the couch, which is fine, or they can go down the length of the couch. What you don't want them to do is put their hands above their heads. And people tend to do this because it's more comfortable because their upper traps are very tight. So it shortens up the muscle and makes it more comfortable for them. But it makes it almost impossible for you to do sort of, as Charlotte's doing here, getting into the upper traps and along supraspinatus, that sort of stuff. So always arms down over the edge of the couch or down along the length of the couch.
What you can see here, hopefully, is some really good posture, if I do say so myself. So this is for a compression into the upper traps. Now you can see very clearly that I'm lunging. I've got very straight arms, neutral spine. There is no force or pressure in my body. I look very relaxed, very comfortable, chatting away to my client to communicate. And you can see how I use the lunge to take the pressure on and off. I know we've sort of mentioned it a few times, but it's so important to not be trying to bend your elbows here and force the pressure on. Keeping your arms straight makes life so much easier.
And it's going to lengthen your career. If you ruin yourself by having poor posture, you're going to spend more time getting massage yourself and trying to sort yourself out than you are actually treating. So pay attention to what you're doing.
So again, a compression can take quite a long time. Now what I've used in this example is some really gentle petrissage there just to start to flush it out. But also now working across the body, so it's a different angle. You can work the lats really well from this, which is what we're looking at now. I love a little bit of petrissage across the body. Can be much easier than working on the same side. So again, don't be afraid to move your feet to make life easier or more effective in your treatment.
And Charlotte really does move around the couch, and I do when I treat as well. It's really important to be in the right place. And it, you know, if you've got to shuffle a bit, but make sure you're comfortable when you're treating.
And while you're doing that, don't be afraid of you lose a little bit of contact, but actually you'll see a lot of the time you keep your hand on your client. You might be sort of moving around, but you still make sure they know where you're going, what you're looking for. I'll often then go back to something that I've done earlier. So hopefully you saw there again that little bit of almost pull and mobility work, just to see if what I've done with my treatment, has that made any difference at all, or if there is still a little bit of tension as we start to move the shoulder around.
A lot of the techniques you do use do allow you to be able to see where changes have happened, don't they? So some of the effleurage, especially those kind of mobility type movements, will help to see how things have changed. That's why I like rocking so much on the back.
Yeah, it's really important as you're going to review what you've done, mix it up a little bit. And so you can see here, having warmed everything up, perhaps you may put in a little bit of shaking just to mix up your treatment. Again, you're levering the arm very gently, not trying to pull someone's arm off. But then go back in. Has it actually done? So you're testing your results all the time of what you're actually doing with your treatment.